Next, we have Brittany Johnson Hernandez, who is the Senior Director of the Policy and Advocacy for the Muscular Dystrophy Association. In this role, Brittany leads MDA's advocacy work across the United States to promote policies that advance the priorities of the neuromuscular disease community. Prior to her role at MDA, Brittany directed the Federal Affairs Policy Portfolio at the March of Dimes, where she focused chiefly on guaranteeing quality healthcare coverage and access for pregnant women and infants. And she has worked on the staff of a member of the U.S. House of Representatives for over 8 years, serving as Chief Policy Advisor on healthcare, accessible transportation, and many other issues. So, Brittany, thank you for being here today. I'll let you go ahead and present your presentation.
Great, thank you so much, and many thanks to everybody who has joined us for this event today. I'm so glad to be able to share this with all of you. So as Nicole said, I lead MDA's public policy and advocacy operation. There are a few of us on the team, but we have a broad portfolio of issues, and so I'm going to go through some of those today and then share how you can get involved. So I will share my presentation, and I will just say, if there are questions, please feel free to enter them in the chat box at any time, and I am happy to address them as they come along or later, and there will be information on how to get in touch with me at the end of the deck. Okay, so we laid out some advocacy priorities for 2020 back in the beginning of the year, and we organized our work into 3 pillars of priorities. And let me just preface this presentation by saying that in no way is this exhaustive of all of the work that we do on advocacy policy. These are just a few things that we've been focusing on, and there's a lot of other stuff going on. It's just in the interest of time, I'm hitting kind of a lot of the high points here. So we organize ourselves into 3 pillars: access to care and therapies from day one, acceleration of therapeutic development, and empowerment and independence. And I will go through each one of these for you. All right, so the first one, access to care and therapies from day one. I know there's a lot of stuff on the screen here. There's a lot that we do here, but really what this boils down to is ensuring that people can get diagnosed as soon as possible, so elimination of the diagnostic odyssey, and that when they're diagnosed, they're connected to care immediately, that care gets them, any therapies or other treatments that they need, and that they can have health insurance that actually covers it and is affordable and accessible. So what we do here, to break that down a little bit more, is ensuring that pre-existing condition protections that were included in the ACA remain, that all insurance is robust and affordable for individuals living with pre-existing conditions, including people in the neuromuscular community, that the Medicaid program is well funded to be able to deliver care to people who cannot afford private insurance. We are working towards the expansion of newborn screening for neuromuscular conditions. 2 of those are already on the national list for which all babies are recommended to be screened, and those 2 are Pompe and SMA, and we're working towards Duchenne and then others after that. And we work on state implementation of newborn screening. So the feds put together a list of conditions for which they recommend all babies be screened, but every state gets to decide, if they're going to implement that list or not, because every state runs their own newborn screening program. So we do engage in state policy on newborn screening implementation. We also focus on access to coverage, and access to and coverage of genetic testing and genetic counseling services. Obviously, genetic testing and counseling are critical to ensure that people can get the right diagnosis. And then we serve in a number of leadership roles in these areas in our work in Washington. So I am the leader of and a founding member of a coalition that focuses on access to care issues, and that's called the Partnership to Protect Coverage. And I also lead an advocacy coalition of other patient and provider groups to reauthorize and fund the National Newborn Screening Program. So our second pillar, acceleration of therapeutic development, I think is pretty self-explanatory. We want more drugs and therapies to be approved. We want them to be approved as quickly as possible. We want them to be safe, effective, and get to the market. And so everything that we do around our work with building relationships and maintaining those relationships with FDA and other policymakers is critical to this goal. We are always advocating to FDA to ensure that that trials can be designed in a way that is reflective of the needs of the community, and that as many people as possible can be participating in trials if they want to. Right now, throughout the pandemic, trials have, things have changed, and the ability of people to make it to clinic or to another trial site is definitely been impacted. And so we've advocated to FDA that they allow trial sponsors to amend trials to ensure that people can continue to participate. We work very hard to forge connections with the FDA, not just between MDA and the FDA, but also to enable other organizations, who represent individuals living with conditions under our umbrella to do so as well. We lead a group called the Neuromuscular Advocacy Collaborative that is not it is not restrictive to FDA work, but there's obviously a lot of work that goes on there, and that's an opportunity for a number of our partners across the neuromuscular disease spectrum to engage with us on issues of shared priorities, including our advocacy to the FDA. Other advocacy leadership roles in this area include our position as a member of the Muscular Dystrophy Coordinating Committee of the NIH. So, many of you may know that there is no National Institute on Muscular Dystrophy and other neuromuscular conditions. And so there's a coordinating committee, though, that works to ensure that the cross-institute work at NIH is reflective of the needs of the neuromuscular and muscular dystrophy community, and we do serve on that. We're also the board chair of the Alliance for a Stronger FDA, which works towards ensuring that the FDA is fully funded, that policies are passed that enable it to work in the most effective way possible for patients and other stakeholders in FDA. And we are really proud to serve in this role and convene a number of other organizations, both across the patient and provider spectrum and developer spectrum on this point. The last pillar is empowerment and independence. And so this is where we organize all our work on advocating for accessibility improvements for people living with disabilities. We know that access to air travel is critical for this community, not just because everyone deserves to be able to fly for work or to see family or go on vacation, but people in the rare disease space generally, the trial opportunity, the clinical trial opportunities or opportunities to engage or to receive treatment from maybe a specialized clinician doesn't necessarily mean that you live in a place where that's available, and you need to be able to fly to get to those things. And so access to air travel is critical. We also work towards promoting incentives to encourage employment of people living with disabilities and neuromuscular conditions. So there is a piece of legislation in the Senate that's being considered that will provide incentives to employers to both hire more individuals living with disabilities, but also to be able to retrofit workplaces to both serve their employees and serve customers and clients, and make those places of work more accessible. And we've definitely seen throughout the pandemic, with more people working from home, that employment of individuals with disabilities has anecdotally we've heard that it's gone up, which is really great, because you're not seeing those kind of barriers to work as you do when you work in an office environment or other workspace. And so those are the kind of things that I think will probably continue to evolve even after the pandemic is over and there's a vaccine. And so we're keeping an eye on that and on legislative opportunities to promote further access to employment and incentives of employers to hire people with disabilities. I will just flag that next month is Disability Employment Awareness Month, and so keep an eye out for some things that we'll be promoting there, and opportunities to get engaged and learn a little bit more about this issue. Obviously, right now, we've got a big election coming up, presidential, and everybody in the House and a third of your senators are all up for election this year. And so we want to ensure that everyone has access to vote. So, to vote in the healthiest way possible, the safest way possible, regardless of whether or not you're living with a disability. So I would recommend that all of you visit healthyvoting.gov to find out, or healthyvoting.org, not gov, to find out, what programs are available in your state to cast your ballot in the healthiest, safest most accessible way possible. Everyone is supposed to have access to voting, and if you or a family member or a friend experience any barriers to voting because of physical disability, that is definitely something that needs to be flagged. And so I would encourage you to share that with your state election office or your local election board. But you can also visit vote.gov to file complaints about that. In this area, we hold a few other, advocacy leadership roles as well, including that we are a member of the Air Carrier Access Act Advisory Committee at the Department of Transportation. And in this role, we serve to advise the department on ways that air travel needs to be improved to serve the needs of people living with neuromuscular diseases, mobility issues, and other disabilities, including people who maybe need oxygen when they're flying. It's not just about being able to board a plane with a wheelchair. It's much broader than that, and that committee is really committed to ensuring that all of those issues are taken into account. And we're also a member of the Air Carrier Access Act Advocacy Coalition, which works towards access to travel for individuals with disability. Okay, so all of this that I said was priorities that we set prior to the pandemic, and the pandemic definitely MDA to add to what we're doing. So we didn't pull back on anything, but we did pivot a little bit to ensure that the needs of this community are reflected in everything that is happening both on the Hill and with the administration when it comes to reacting to the COVID-19 pandemic. So under that first pillar of access to care and therapies from day one, we've been promoting policies that ensure availability of testing and treatment for COVID-19 to the neuromuscular disease community without discrimination. So earlier in the pandemic, there was a lot of news about, we were tracking a lot of instances or some instances of complaints about people being about triage policies for access to COVID-19 treatment throughout the pandemic. And these policies are set in place by states or hospital systems, and basically they are policies to decide, if there is a national pandemic whereby treatment needs to be rationed, they decide how to deliver and to whom to deliver care. And so we, along with a number of other partners in the space, got together and said that it is absolutely discriminatory and a violation of the ADA to deny care to somebody living with a neuromuscular condition throughout the pandemic. And I will say that we were very pleased that the Department of Human Services Office of Civil Rights issued guidance to states and hospitals saying exactly that discrimination in delivery of healthcare throughout this pandemic is illegal, and that it cannot go on. And so we were grateful to see that, but are continuing to track it. Under the area of accelerating therapeutic development, we have continued to advocate for development of therapies throughout the pandemic, and FDA's continued attention to that development, including throughout the trials process. So we have submitted many comments and been in close communication with the FDA to ensure that while they are trying to allocate as many resources as possible, obviously, to reacting to the pandemic, that individuals with neuromuscular conditions and other rare diseases can't wait when it comes to having drugs being developed for this community. And so everything that I mentioned about innovative clinical trial design and continuing to push forward with kind of the therapeutic pipeline is something that we've been in constant contact with FDA and the other partners about throughout the pandemic. And then under the empowerment and independence pillar, we've been promoting policies that enable all individuals to access necessary funds and services. So this is everything from ensuring that people can have access to unemployment benefits if they lose their job due to the pandemic, and everything related to that as something that we have been very, very committed to ensuring. All right, so that's a little bit of an overview of what it is that we do on the policy side. But why do we do it, right? So like this is always the question. Why does an organization engage in advocacy and policy? And we do it because we're here to transform lives of people affected by neuromuscular disease. It's pretty simple, but it's always good to remember what our North Star is, and that is our North Star. Grassroots advocacy is something that we do, and it's led by my colleague Mark Fisher. Many of you, may get emails from him or know who he is. But grassroots advocacy is when individuals, patients, families, clinicians, friends, and family take action directly to their policymakers to advocate for a certain issue. This is a really great picture of the Hill Day that we were able to host last fall before the pandemic hit. So just a few of our families who joined us. It was an amazing day, and they went to the Hill with a number of really great, important asks and talked to their members of Congress, both in the House and the Senate, about those, and we're very impactful. And so we are just so pleased to be able to count on them and people like you to help us move forward with our advocacy priorities. All right, so all of those folks that you just saw on the screen are grassroots volunteers. There are any number of ways to engage with MDA's grassroots advocacy work. We have a number of obviously online activities right now. Everything is online. You can get emails from us. You can tweet to members of Congress. You can take action on agency regulations. You can share your story. Once we're all back to kind of semi-normal, whatever that looks like, we'll be continue to share opportunities on visiting members of Congress to make your ask, calling them. There's always opportunities to write blogs or other pieces with us, and then engaging other members of the community. And I will tell you exactly how to get engaged in that shortly. I will say that, what does this all come down to? Why do we need advocates like you to do this, and not just, me and my colleagues going to the Hill? Because, while I like to think I'm pretty good at my job, I think that when we have patients and families who go to the Hill and who make these requests, either virtually or in person, sharing that personal story of why these things are important to you is absolutely critical, and it is something that I cannot do. I am not, I'm not directly connected. I'm not a parent of somebody with a neuromuscular condition, but sharing that personal story from yourself or your child's perspective makes all of the difference. And oftentimes that is what pushes a member of Congress over the line to decide to co-sponsor a piece of legislation or to oppose passage of something that could be harmful to our community. And so engaging from your personal perspective is the most powerful way to make an impact for our community when it comes to policy and advocacy. And we have lots of tools available to help you guys do that. We've had, because of our grassroots community, we have seen so many successes here in these last couple of years. We've hosted a patient-focused drug development meeting where we got many patients in front of the FDA virtually to tell them, what it was that they need from the FDA when it comes to drug development for them. We hosted a really successful policy and advocacy conference where we brought over 100 people to the Hill to make specific requests. We have seen passage of newborn screening reauthorization in the House last year, and that was due to advocates, due in large part to action of our advocates. We've seen lots of progress on accessible air travel after the conference. One of our asks at the advocacy conference was to take action on accessible air travel, and after that, I would say that we saw so many members add themselves as co-sponsors of that bill directly because of requests our advocates made. We've seen increases in NIH research funding, which everyone here knows is critical, and we've also engaged our advocates on COVID-19 emergency legislation to serve the community. So I think that it is really clear that engaging with that, having our advocates and our patients and our families directly engage with policymakers really does make all of the difference for us and getting our priorities over the finish line. There are a lot of ways to get involved with us. The first and most important one is to visit mda.org/advocacy and sign up to become an advocate. If you do this, and when you do this, you'll start getting emails from us to keep you in the loop. and allow you. We send out a monthly update to update the whole community on what it is that we've been doing every month, so that there's no surprises. We will email you opportunities to take action directly to your member of Congress via, email or call or tweet. And then we also are really active on Twitter and would request that you follow us on at MDA_advocacy. And you can find all this information again at mda.org/advocacy. That's it. I am happy to take any questions. You can also email advocacy@mdausa.org with any questions. And we'll be pleased to get back to you as soon as we can. But thank you for your time, and I really appreciate it.
Thank you, Brittany. Can you tell us what that Healthy Voting website was again?
Yes, so it's healthyvoting.org. And it is a nonpartisan, non-political website that just provides links to every state's voting resources, so that you can figure out, does your state allow, vote by mail or without reason or anything. It's a really great resource.
Okay. And is there training involved with becoming a grassroots, or is it simply just fed through emails and you kind of partake in what you want to partake?
So we actually have monthly Advocacy Institute sessions, which are not trainings per se, but more of an update on certain issues. So each month we'll specialize in a certain issue. And so once you sign up for the network, you'll get information about how to join the Institute and view those webinars that we do every month. And they're all recorded and also posted to the website.
Okay. And could you give an example of improved air travel that's happened through our MDA initiatives with improving air travel, or accessible air travel?
Yeah, so I will say that this hasn't been implemented yet, but during the last FAA reauthorization, which happens, supposed to happen every 5 years, but during the last FAA reauthorization, we fought for the inclusion of a provision that would require the FAA to undertake a study on the feasibility of people traveling in their wheelchairs. So being able to travel, without having to stow your wheelchair under the plane. This is something that took a really, really, really long time to get included. The level of bureaucracy at DOT is something that I think everybody could probably imagine is pretty high. But though now DOT is undertaking that study because we were able to get that included in the last reauthorization, and that's something that I'm really excited about. I think that the implementation of that will obviously take a long time, but I'll be clear that MDA hasn't really engaged on air travel for decades. This is a relatively new venture of ours in the last few years, and so seeing something like that get included in such short order is very, very exciting, and something that I'm really, really pleased to continue working with DOT on.
And they review that every 5 years, the DOT does?
Yes.
Wow.
Well, so Congress passes the reauthorization of the Federal Aviation Administration Act every 4 or 5 years.
Okay.
So there's always, every time there's a reauthorization, there's an opportunity to include, new provisions related to air travel. And so that's really the best vehicle to try and get new provisions included. I will say that it is one of the more difficult vehicles like in Congress to get things included in, though, just because of the level of different interests from, the airlines to the manufacturers to whomever else. But it is something that is supposed to happen on a regular basis. But with Congress, you never know.
Well, that's great that we were able to get that pushed through.
Yeah.
And then one last question. Can anyone join the Alliance for a Stronger FDA, or is that only a it's an organizational, it's organizational opt-in, right? So we and a number of other organizations and trade groups and businesses are members. Okay. Well, thank you, Brittany. I don't see anything else that has come through. I appreciate your time this morning. Have a good rest of your day.
Thank you. Everybody have a good day. Bye.
Bye-bye.